Hello, Apollo Health Therapy, back with another hopefully helpful tip for people with asthma. If you are on an inhaler, you may not recognise the symptoms as to when you might need to ring the ambulance because you've been dealing with it for years. However, there are a few tips that you can actually do to also help yourself get that medication into you a lot quicker. So I haven't got asthma, but I'm going to pretend this is my inhaler, a box of vitamins, which I don't take either because they're still full. I tend to use my own natural fruits, etc. and veggies to get it. So this is going to be my inhaler. Now, correct way to take it is if you are stood up, because some people find it easier, make sure that you can use either a chair or a table and brace yourself forward. The reason we do that is it opens up this airway so that as and when I go to take my inhaler in, it makes sure that I've got the big enough airway for that to get in. You can take your inhaler as many times. The blue one is for emergency purposes. It needs to be on you at all times. If you fail to take that into work, they can and have the right to send you home. It's health and safety. It's your responsibility to take that in with you all times. Steroids you can leave at home because you can just take them as and when prescribed, which is the other ones that a lot of people have. Another thing you can do, if you don't want to stand and people are insisting you sit down all the time, especially if a first aider's on scene, they might ask you to sit down. Sit down and utilise your own body to make a triangle. So let's see if I can show you what I mean by that. So lean forward and put your elbows onto your knees. Can you see what I'm doing there? And the reason, again, you do that is because you're opening up that airway, making it nice and big. And it also allows you or anyone to assist you. You put your elbow on the end, you can still take the inhaler quite safely, but it allows that whole of that airway to open. When would you need to call for an ambulance? Now, you might know in your own asthma history when to call for an ambulance, but another thing to look out for is the rigors, the shaking. That means that the medication is no longer working. What it does is, as and when you're pushing this, you keep pushing, you keep taking it, keep pushing, keep taking it, keep taking it, keep taking your inhaler. There will be a point at which your lungs are then full of medication. Medication is not designed to know when you take that inhaler that it should go to your lungs. We know that that's what it's for, but the medication doesn't have a brain. What it does have is that it's shaped in a set way that the chemicals on it are supposed to be attracted and get onto the synapses in the cell. The synapses opens and it gets delivered into the cell. And that's how we have medication. So when you take an ibuprofen, for example, it doesn't know that you've got a headache. What it does, it goes in and it looks for the receptors that are in the body that are designed for that medication. So every type of medication is designed in a set way for it to find the right receptors within your body. So there are set receptor shapes in your lungs that asthma inhalers and other inhalers are designed to look for. It finds it, it attaches to it, great, and it all works effectively, and that normally is the case. But if you ever find yourself at a point where you're kind of involuntary shaking, or somebody says, oh God, they're shaking now, that actually means that what your body has done then, your lungs are completely full of the medication. So when I then go and press the next time for the inhaler, it will go off and it might have clung on to a different receptor that is not working, it's not the right shape. So therefore your body goes into involuntary sort of shaking. That means that your drug is no longer working. You need another type of drug, which is why ambulance then carry other types of drugs. That's why hospitals have different types of drugs, or it might be a different pathway, i.e. you might have to go on to what we call a CPAP machine, which you've all probably heard about recently with the COVID patients. Asthmatic patients can also go on to those sometimes if they're having a bad enough asthmatic attack. What we do need to do is you do need to go into hospital. I know you think, oh, I might be able to cope. No, we need to make that phone call and you need to go in, and you need to go in quite quickly because we might need to give you another type of medication. If ambulance does come, they can sometimes make the decision that after they've given you a different type of drug whilst they're there, they may keep you at home, but don't be surprised if you do go in. if you've ever been in hospital and you've got to the point where you've ended up in intensive care or on a critical ward, it's really important that you tell ambulance and crews that arrive, and also A&E if you're going in through that route. And even your GP needs to be aware of any times you go into hospital, just so that everyone knows and they can all treat you to the best of their ability. That is asthma, and that's how you should help with anyone with them taking it. Don't let them lean back, get them sat up forward. Remember to make that tripod position, either standing or sitting down, and sitting forward so that they can get that medication right into the chest where they need it. The other thing you can help them do is try and do a breathing technique where they kind of breathe and they're really concentrating on kind of making a round shape with their mouth and blowing out, and out nice and steadily. So I recently gave this to a tip for somebody when they're running. So when they're running, go, you're really concentrating on blowing on the outward breathe and exhaling all the way out. A bit like when you do yoga and things like that, you do nice inhale, but you always try and really exert that exhale, and it gets to the bottom point of the lung, and it basically brings up the last bit of oxygen and out, and it kind of really concentrates the lungs, and it gets the whole lung working properly. So that's another tip that you can do. Maybe you might want to do that when you're taking your inhalers as well. Hope you're all safe out there and keep well.